Hello, everyone. If you are here for the BaxRx to learn more about the group side, you are at the right place. My name is Naomi, and I am from IFC, and on with me from IFC is Todd Stead on the group benefits side of the house. And then we also have Cody, John, and Jack Kelly. They're going to talk to us about BaxRx. Just a few little housekeeping items. You are muted. You are going to stay muted. We are recording it, and if you have questions, please put them in the chat. Todd Stead is going to be monitoring those questions, and they will be answered at the end of the presentation. Again, we are recording this, so we will put this in our Monday memo, and we will also put it on our website once it's been processed. So it's going to take a couple of days to get all of that done, and then we'll have it on there. Gentlemen, it is all yours. Take it from here.
Great, thank you, Naomi. And so today we go to the agenda here, and this will be available this presentation will be available as well in a couple of days for you to have as well, so you can see some of the information on it too as well. But we'll go through some of the problems out there with prescription and healthcare, what we see in the group market. Give you some highlights about the program and walk you through a high level of what the app looks like, and then we're going to save enough room at the end as well, about 10 minutes for questions. And so we'll get to some questions here. So if we kind of start off here. So what is BaxRx Plus? It's a prescription wellness product, and it's really to cure a problem, as you guys are seeing out there in the group market, is where we started here well over a year ago and had a lot of success with the groups, and it attaches to group health insurance. And why is that the case? Is because what you're seeing out there, group health insurance is growing at 6% a year, but prescriptions are really driving a lot of group health cost up over the years, and we're seeing it grow at 8 to actually 10% growth, which is higher than just your just claims of group there. But one of the main things too that we're seeing there is 67 or 2 out of 3 employees or Americans are on prescription. So we're seeing high numbers, more than ever before. In 2019, it was only 1 in 4 only, but it is 1 in 4 today. It's 2 out of 3. So we're seeing a huge growth there too as well. And what we're also seeing there too is the average employee, the average person is 4 prescriptions is what they have. But another big thing too that's really troublesome to HR people as well is 33% of the employees are not picking up their scripts. So they're being filled at the pharmacy, but they're not being picked up due to cost. And kind of sounds weird in a way, but with a lot of cost shifting and whatnot, it's getting expensive out there for drugs to be picked up. Even though over 90% of all prescriptions, for groups are going to be generic. That's what it's going to be. So we're seeing a lot of high costs there. So next, here's the impacts that you're seeing, and we're seeing too with employers, and why we created this program is the health insurance premiums, drug claims, experience, etc. It all goes into the whole full experience of groups. So we're seeing drugs are driving up, renewal pricing. We're seeing employers, especially in large groups, self-insured, level funded, etc. We're seeing, really self-insured large group. We're seeing cost sharing where employers are changing deductibles, copays, etc. to try to get the pricing down. But also, we're seeing it in a big HR retention recruitment. It's affecting their benefit offering. So, do they change up their out-of-pocket, the deductibles, et cetera, to try to bring down the costs? We're starting to also see a separate deductible in there for prescriptions. So that kind of is hurting retention and recruitment. But to the employee side, looking at that, back to that, that stress, the financial stress. You got inflation, you got everything kind of hitting the employees. You got now higher costs, formulary on a drug plan that's completely different or higher. You're seeing employees missing their medication. So if 33% of employees aren't picking up their scripts, they're not adhering to their medication. And a lot of medication, you got anxiety medications and other types of medicines. So that's affecting work. So employees' sick days have been increasing, as well at work. Their performance at work has been dropping too as well. So these are kind of big key factors that we see with regards to not only the CFO and health insurance increase. This is one of the drivers, but also the HR department. You're starting to see, hey, this is really having an impact on our employee population and our work production. Next. And so what we created here is with Bax Plus is this prescription wellness program, and we call it the pharmacy of the future. So what are we and how does it work? It's basically, we're not insurance. We are a pharmacy. We're a private pharmacy, 32,000 square foot pharmacy, online pharmacy, where we buy all of our medications, generic medications. We buy them all directly from the manufacturers and store them, and we're able to fill them using state-of-the-art machines. Our pharmacists are all on staff there. Our coaches, our call centers, we answer the phone. Everything is right at one location where we can work directly with members. And we're able to provide over 815 of your generic drugs, which is going to cover basically 93% of all conditions that prescriptions are written for. So we're matching up. We're getting, so when we see claims on a group, the worst claims we've seen, at least 83 to 90% of all group claims have been able to be filled by our pharmacy. And what we do differently, though, it's all packed into one offering. So if you go to the next one, Jack, for one membership, monthly membership fee that the employer can pay for, it's a benefit, so it's pre-tax write-off for the employer. It can go through the cafeteria plan. It can also be used with an HSA because we're not insurance. We are a pharmacy. What we're able to provide chronic, close to 700 chronic medicines. We're able to mail them, so 90 days, so we can get them on that program for 90 days. It's all included, free, counseling free, from our pharmacists working with them. Also, too, what we do differently is we've also have agreements with over 64,000 pharmacies. So not only are we able to get mailing on a chronic medicine, which people love because it's convenience, we have 64,000 pharmacies you can go pick it up as well. So you have the choice to pick it up from local brand names of CVS, Walgreens, etc., and show your card, and you get it for free. So a lot of times, if you got maybe a moxicillin or something like that, and you need to get it right away, hey, you can just have that script sent to the local pharmacy. You just swing on over there, pick it up, and you got it right away for the kids. And off you go. All part of that $25 a month. So next. So what we're doing, which is completely different, is by bringing a private solution to employers. We're being able to take 90% of the claims that they normally would have, put them with a private pharmacy. So gone are the pre-authorizations or anything like that. This is not a discount card. This is an actual pharmacy and a network of pharmacies out there that are working together to go direct to consumer. What this does for the employer, where the wins are going to come, is it's going to help with lowering health premiums because we're moving claims away from the insurance company and their PBM going direct. We're able to bring the drug spend down that we're seeing across the board, even for large companies that we did one for 80,000 people, 30 to 40%. A lot of cases, it's really right around that 40%. Give predictable drug spending, so it's one flat cost. That's all it is. No co-pays or anything with that. It's just $25 a month, and you get it all. Employees are seeing huge savings. Average employees, spend about $1,500 a year. Now employers giving it. If the employer's paying for it, they're getting their meds for free. So huge impact on employees, because as they take their medicines on a daily basis, they're seeing and feeling that impact of a benefit that their employer's given them. And also too, they're going to be adhering to their medicine. So we reduce that too costly. This is a unique product that's going to help to attract and retain. So it slides right in there next to the health plan and will help that health plan. So it's unique, different, and like I said, 2 out of 3 employees are on medicine. So you're going to get the employer gets a big bang for their buck. Centralizing everything, we're going to be able to know the impact of, work with those customers, those members, better than any other pharmacy. So we're able to do shipments. If they're traveling and they forgot their meds, we can send meds to them. Or if you got snowbirds and they're all over the place, we're able to have that really one-on-one experience that you just don't get anymore at the local pharmacies. And so we'll kick it over and show a little bit more about what it looks like.
Yeah, so I'm going to, this is not meant to be a full demo, so we'll send out some more webinars going over a full demo of what this looks like for you coming up here within the next few weeks, I'm sure. And so this is just going to go over a few of the high level items of what does this look like for you. So you getting started, what are you going to have access to? How would you sell this? So I'll walk through the portal and then the app very, very quickly. But when it comes to getting started and getting set up, what we do is we do provide a free broker portal. And so what happens is you will all receive your own personal link to get signed up for the platform. And the way you want to think of this is it's just going to be like your normal broker portal where you can manage your book of business, you can invite groups, you can add employees for them. All the actions that you would need to do, you would have access to do that on here. And so what we're looking at now is an example of the broker portal where we have the employer groups tab up. And what happens is you can see there's a button on the right that says add employer group. If I were to click that, I'm just showing you kind of how easy this looks. So you would put in your clients or the employer group. You just put in their basic information. And what happens is an email invite goes out to them, and they will simply be asked to come on the platform, because we do provide this portal to employers as well, so they can manage things. If you want to manage it on behalf of them, of course, you can do that. But that email would get sent out to them. You would see them show up in the portal, and then the other, and I'll show what that employer portal looks like in a second. But the other option for you as a broker or an agent would be the individuals tab. And so you do have the option to take this to individuals. And when I say individuals, I just mean anybody not a part of a group. So either one-off people, ACA people, Medicare, anybody, your neighbor. You'll have access to add people from your portal. If you look on the right, you'll see my promo codes and you'll see add individual. So if I click add an individual, all we really need is the first name, last name, email. The same thing does apply where we'll send out that email invite. We'll track it for you, pay you out if anything happens. If I look on some of these tabs, we'll be able to track the user when they sign up and when they upgrade to this program, and we'll pay out the commissions on that. So it's very, very easy to add an individual. Again, not a full demo, but I can go over that more later. And then the only other thing that you need to know now is there is that My Promo Codes button. So on here, all of you are going to get your own personal referral link. So you would be able to just copy this link, send it out to any clients, to any of the individual people that you want to, and then we will track it for you as well and pay you out the commission. So it's just a nice, easy, centralized place for you to kind of see everything, add your groups, add your individuals, see your commissions, everything like that. Okay. The other part to this, the employer portal, very quickly, when you do invite your groups, they will be prompted to sign in. They will get access to this. And so the actions are going to be limited for them. So really all we're doing is we're just allowing them to add their active employees or who they want to be a part of this program. And so on the employees tab, all we're doing here is we're adding employees. Of course, this is a demo account. And so you just come on here, add the employees that you wish to be active on this program. You can do the enrollment however you wish, whether it's putting it into an ease, going hand up if you want it, going paper, however you wish to do it. You just upload the active employees that you want. We'll bill automatically and make them active on the first of the month. So super easy management. You're just adding and terming employees. The billing is automatic, so there's no need for the employer to do any actions. You as the broker and agent are able to add and terminate employees for them, or they can do it themselves. And so really that's it. And then we will show the bill for the employer as well. So try to keep it limited. The only other thing I want to walk through quick is what does this app look like? So we have the broker portal, which I just went through, but I want to show you what the mobile application looks like. And the way that you want to think of the difference is going to be the broker portal will be all those actions that you'll be able to take, manage the book of business, invite people. The discount card, or the mobile app, I should say, I'm just looking at this, is going to be where all the actions for the end user are going to be. So think of the employees using this program, the individuals using this program. They will use the mobile application. I'm showing the free version of the app. Our app is free to download. We do provide a discount card. That's not what we're promoting. It's just something that we do on top of everything. So this is what it looks like when the user first comes on. They're able to search their prescriptions. What we really want them to do is to do our BaxRx plus wellness program that we just talked about, with having access to private pharmacy, set monthly costs, free prescriptions. That is in the mobile application. Users are able to sign up right there. If the employer is paying for it, we give the employee the codes and they get in for free. That is how that works. Finally, when they're using this program, and again, this is a lot since this is the first time you're seeing this, but it's very simple user interface, not too many actions to do. We want to try to keep it as simple as possible. But you'll see as you're looking at a user who is now part of the BaxRx Plus pharmacy program, we give them pharmacy access on the right-hand side, if you can see. So we will give them their member ID. We'll tell them, get started. They can call the pharmacy, talk with our pharmacist. They're able to work with their doctor, prescribe their medication to our pharmacy. Everything that they need is going to be here. And then, as we were saying earlier, if they do have short-term medication they want to pick up for free, if you look on the left, we do provide another card that the member can walk into any pharmacy in the country and pick up their prescription for free just by showing this card to the local CVS or Walgreens or anything like that. So those are the two options on the member experience. And so with that, I will, again, the last thing I will say before I kick it over to Todd quick is a full demo walkthrough will be coming next. I just wanted to show some of the highlights of what this looks like so you at least have some idea of the UI and everything like that. So I will kick it over to Todd to finish up before we get to questions.
Yeah, thanks, Jack. Todd Stead, Regional Group Benefit Director, IFC National Marketing. And really wanted to circle back to one of the points that John brought up at the beginning of the conversation, and that was the point about RX costs driving a lot of the medical plan rate increases that we're seeing today. And specifically in the small group market, the 2 to 50 market, the proposed rates that have come out, every carrier other than Medica, I should say, is coming out with an average of 10+% rate increases, which is definitely a little bit larger than years past, or at least the past 3 or 4 years. And to a carrier, each of them mentions prescription costs as being one of the drivers. Inflation being another one, of course, but prescription costs are definitely driving some of these increases. And whether it's the popularity of these new GLP-1 medications or state mandates that are coming out on certain medications, as I said, without question, prescription costs are driving some of these increases. And specific to the screen we're looking at here, what's an ideal customer profile? Groups on a MEC plan or a minimum essential coverage plan. Typically you're going to see these plans with groups 50 plus that have to offer some form of a health plan, and it's a way to avoid some of the Affordable Care Act or ACA fees. Obviously, groups with no health plan. This is something that employers can offer those groups or those employees as a nice benefit if there's no group plan in place today for, again, typically a 2 to 50 size employer group. And same thing with groups with low health plan participation. Employees might not be on a health plan, but companies can still offer them this prescription medication, this service through BaxRx. And then the last three I'd kind of lump together: the level funded plans, the large groups, and large group fully insured, and then large groups that are self-insured as well. What's great about these types of groups is that you can actually see the data, and you know how much prescriptions are, overall expenses are driving the cost of the plan. And so it's very easy to pick out the plans where the BaxRx program could be a great benefit with these level funded and large groups. And just as a side note to that, 2 conversations yesterday, in fact, with carriers about BaxRx specifically. And if you have a large group, if you have a level funded group where the plan's experience is affecting the cost of the health plan, if you as a broker implement BaxRx with those groups, let the underwriters know with the carriers that BaxRx is going to be implemented, because the underwriters can factor that into the rates that they ultimately offer the employer group, whether it's a new group, whether it's a renewing group. And so certainly bring it up. Talk to your health insurance, your carrier rep, who can then convey this to the underwriters that, hey, we've got a prescription management program in place that can help offset some of these costs that we're seeing. And so just one thing to bring up there as well. And association plans obviously can be a factor as well. So again, I think the BaxRx for employer groups is something you definitely want to take a look at and review, as is something that could be a great benefit to employer groups and obviously the employees at those groups. You want to go to the next slide?
Awesome. Yeah. Is there any questions that people have? And Todd, if you have any more you've come across?
I do not see any questions in the chat at the moment. And just to follow up on the last slide here, contact information with IFC National Marketing, Ethan Anderson. Also, you can contact me, Todd Stead, at IFC if you have any questions about this. And as many of you probably work with Troy Stenzel, certainly Troy is open and available for questions to help with BaxRx as well. And just to follow up on the housekeeping items, we are recording this call. So we'll get a recording available to you after, and then we should have that in a day or two here, posted on our website as well. It'll go out in the IFC. We got the Monday newsletter that goes out. We'll post it to the newsletter. And I'll also try to get this information out along with the recording of the webinar directly to many of the group benefit agents we work with, just on a direct email basis. So certainly trying to get the word out to everybody. There's been quite a bit of buzz about BaxRx, whether that's internally with IFC and our employees, but also with our agents. I would say both. Yesterday there was a Medicare webinar, how you can use BaxRx for Medicare participants, and then obviously today the BaxRx employer group webinar. And so I think it's definitely something everybody should take a look at and consider quite closely. And yeah, Jack, just to follow up, I still at this point do not see any questions in the chat. Perfect. So if you have any closing comments, feel free.
Yeah, that's no, that sounds great. I think we did cover a lot. So Todd kind of wrapped this up there nicely. The one thing I will leave you all with here before we close it then would be, there is IFC will definitely get you up and running on this if you would like. It's free to all of you, so we do want to get you set up and make sure you're taken care of. And then there is going to be, the one thing I did not touch on is there is on-demand training. So when you get set up on your dashboard, there will be on-demand training videos for you right there. And so you will be able to walk through what does it look like to add employer groups, add employees, add individuals. How do I sell this to employer groups? How do I sell this to employees? What's on the formulary? What are some marketing materials I can send to my employer groups to take a look at this? All of those items that you're gonna probably want and need, we provide it all in a tab on the profile right there in your dashboard. So a really good first tangible step would be to reach out to Ethan, reach out to Todd, have them set you up for free, and then take a look at all those resources. And if you go through that, you're going to have everything you need to be equipped to start on this tomorrow. You will not, there's really nothing else you would need. And IFC is there to help you. We're there to help you answer questions, make sure everything's working, of course, but you will have all the resources you will need to get started. So that's kind of the nice thing that you can start tomorrow and everything would be up and running and good to go. So that's all I have. And
I got one thing.
We'll send out this webinar and then it'll be good to go.
Before we kick it over to Todd, I just wanted to highlight one thing there that Todd said, and continue to contact Todd with regards to reduction in group premium by adding BaxRx to it. That is a competitive advantage that IFC has over the whole market. Great for group takeover. You can go in there and actually bring down cost and put another benefit in there that others can't provide. So that is a huge thing that Todd mentioned there. And contact Todd and he can help you more with that one. But that I just wanted to really highlight that piece.
Yeah, agreed, John, and thank you for that. And as I said, that was in, like I said, 2 conversations directly with carriers yesterday, and that obviously that's going to apply to large group. Small group market 2 to 50, you got fixed costs. You can't bring those premiums down, unfortunately, at the moment with BaxRx, but certainly with level funded plans and large groups, both fully insured and self-insured, bring it up with the carriers because they'll factor that into how they price the premiums. And with that, still no questions. So as I said, we'll follow up with links, with emails. We've got PDFs of the PowerPoint presentation here, marketing materials with BaxRx as well. So just let us know what you need to help get everybody going. And with that, we'll close it down. And again, thank you for the attendance today. Appreciate it. And we'll be in touch. Thank you much.
Thank you, everyone.